Urine is like a daily news report from our bodies, carrying telltale signs of what's happening inside. While the color and smell of urine can offer some clues, it's the microscopic world within that often holds the key to crucial health information. This is where microscopic examination of urine comes in, acting as a powerful tool in medical diagnostics. Our urine carries waste products filtered from our blood by the kidneys. Examining this waste under a microscope provides insights into our body's health. This test can reveal conditions like infections, kidney stones, diabetes, and even certain types of cancer. It's a non-invasive procedure that offers a wealth of information. To unlock the secrets within urine, we turn to the world of microscopy. The primary tool is the light microscope, magnifying objects thousands of times. Imagine zooming in on a grain of sand and seeing landscapes unfold. That's the power of a light microscope. It passes light through a urine sample on a glass slide. The light passes through lenses, magnifying the tiniest structures. Urine transforms into a dynamic landscape teeming with cells and crystals. Each element provides valuable clues about our health. Before we can delve into the microscopic world of urine, the sample needs a bit of preparation. This ensures that the elements we're interested in are concentrated and easier to observe. The process is similar to panning for gold. We need to separate the valuable nuggets, like cells and crystals, from the surrounding dirt, which is the liquid portion of the urine. This is where a centrifuge comes into play. This nifty machine spins the urine sample at high speed, forcing the denser particles like cells and crystals to collect at the bottom. The liquid portion, now clear, is carefully poured off, leaving behind a concentrated sediment at the bottom of the tube. This sediment is then carefully transferred onto a glass slide, ready to be examined under the microscope. This simple yet effective preparation technique ensures that we don't miss any of the crucial microscopic details that might hold the key to a diagnosis. Section 4. White blood cells, sentinels of the immune system. Among the many elements visible under the microscope, white blood cells or leukocytes are particularly important. These cells are the sentinels of our immune system, always on the lookout for invaders like bacteria, viruses, and other harmful agents. When we see an elevated number of white blood cells in the urine, it often signals that our body is fighting off an infection somewhere in the urinary tract. Think of it like this. Imagine our urinary tract as a series of canals. If there's an intruder in the canals, our immune system dispatches white blood cells to the scene to neutralize the threat. The presence of white blood cells in urine isn't always a cause for concern. Sometimes it can be a sign of a minor infection that will clear up on its own. However, a high count or the presence of certain types of white blood cells can indicate a more serious infection requiring medical attention. Section 5. Red blood cells, not always a cause for alarm. Red blood cells, or erythrocytes, are another common finding in urine microscopy. These cells are responsible for carrying oxygen throughout our body, and their presence in urine isn't always a cause for alarm. Strenuous exercise, for example, can temporarily increase the permeability of the kidneys, allowing a small number of red blood cells to slip through into the urine. This is usually harmless and nothing to worry about. However, a large number of red blood cells in the urine, especially if accompanied by other symptoms like pain or difficulty urinating, could indicate a more serious underlying condition. This could range from urinary tract infections and kidney stones to more serious conditions like kidney disease or even bladder cancer. Therefore, it's crucial to consider the context, accompanying symptoms, and other factors when interpreting the presence of red blood cells in urine. Section 6. Casts. Taking shape in the kidney's labyrinth. Casts are cylindrical structures formed in the tiny, intricate tubules of the kidneys. They are made up of various materials, including proteins, cells, and debris that stick together within these tubules. The presence and types of casts in urine can provide valuable insights into kidney health. Imagine the kidney tubules as a network of pipes. When these pipes are healthy, urine flows freely through them. However, when there's inflammation, damage, or blockage, various substances can accumulate within the tubules, eventually solidifying and forming casts. The type of cast observed under the microscope can pinpoint the underlying issue. For instance, hyaline casts made primarily of protein can indicate dehydration or strenuous exercise. On the other hand, granular casts containing cellular debris might suggest kidney disease. By identifying and interpreting the different types of casts, healthcare professionals can gain a better understanding of what's happening within the kidneys and tailor treatment plans accordingly.